Hey everyone, welcome back to the Legacy Years podcast. We are back with Melinda. Melinda's been with us a couple of times before, and she had such a big topic that we have broken it down into 4 segments, and we are back with you to talk about the third segment.
Yep.
So, welcome, Melinda.
Thank you. Thank you.
Yeah, I'm happy to have you back. I know this is a big topic, and so I'm glad that we have split it up so people can really fully understand. I've noticed that we're getting quite a few views on the other one, so it's obviously a topic that people are interested in. So we're talking back Medicare, all things Medicare, and today we're going to break down open enrollment because it's confusing.
Mm-hmm. Yes.
And there's not just I've always thought, oh, like when we do our insurance coverage as employees of a company, it's open enrollment. It's a few weeks or whatever, and then it's over. But it's a little bit different and
It,
sort of the same.
yes, it is. Which means what? It's a little
Right,
different and sort of
exactly.
the same. Huh? Okay. So let me start with when it is. That's a
Okay.
good place to start. So yes, Medicare's open enrollment period are kind of weird dates. October 15th through December 7th. They couldn't have picked the 1st through the 31st or, any
Too
sort of
easy.
normal dates. Nope. October 15th through December 7th. That's when you need to review either your Medicare Advantage plan or your standalone Part D prescription drug plan, depending on how you get your coverage. Remember, we discussed paths in a previous podcast with Kristy. If you have not seen the path podcast and don't know what I mean when I say the path of Medicare Advantage or the path of original Medicare, stop right now and go look at that one because we can't go into that again.
Right. No, we don't have time for that.
Right, we don't have enough time. Nobody has enough attention. Too long, didn't read. Okay.
Right.
So open enrollment October 15th through December 7th. It is a critical time period to review the Medicare Advantage or Part D drug plan you have. Now, let's say your medications are the same. Your health is the same. Your doctors are the same going into next year that they've been this year. This is the question that I get. Why would I waste my time trying to review the coverage that I have when it worked just fine for me this year? That is the question. And you know what? I'm going to be honest. That's a very fair, legitimate question.
Yeah.
Here's why. Everything worked well for you this year. Your plan this year will not be the same plan next year. Yes, it was your medications were covered this year. Your doctors were covered. But you know what? Your plan next year can change everything about that coverage. It can change the premiums, the deductibles, the out-of-pocket costs, the pharmacy networks, the provider networks, the restrictions that you have to jump through to get medications or doctor services. It can change the medications they cover and don't cover, all while keeping the same plan name next year. You
Which
could
is
have
crazy.
right. You could have an entirely different plan next year with the same plan name. That's why it's super duper important. People just assume that their coverage is going to be the same as it was every year. It is not. And I will tell you, I have hundreds of clients who would tell you that because they themselves learn the hard way come January or February of the next year. Oh, the medication I used to pay $10 for now costs me $100. And inevitably you will see the impact of this. You will see news stories where
Right.
the reporters are talking to seniors and the seniors are waving their fists going, those evil drug manufacturing companies sticking it to seniors. I used to pay $10, but now I pay $200. Yeah, it is much more likely that your drug coverage changed and you didn't pay attention during open enrollment. I'm sorry.
Yeah.
You gotta pay attention.
I've heard a lot of those stories from the seniors that I know who are on Medicare. And I even will say, because I've learned from folks like you have to look at that every single year. Just like we tell them, look at your homeowner's insurance every single year. They need to be looking at this every single year.
Yeah.
So
It's a big,
who's
big deal.
responsible? Right. So how do they find that information out? Obviously, they personally, it's probably, is it sent to them? Are
Yes,
the
it is.
medical companies required to say, hey,
Yes.
same plan? Yeah.
Yes, actually by law. And this is even more frustrating. And by the way, for the people listening to this who are like, this is unfair, this is awful, this is not how it should work. Believe me, I hear you. I hear you. I wish it were different. It's not. So when the rules are structured in a certain way, unfortunately, we just have to suck it up and do the best we can because it is what it is. So when you are enrolled in Medicare, you're enrolled in Medicare, but you are not done. Each and every year for the rest of your life, start putting it in your head that each year in fall, Thanksgiving time, Thanksgiving, you give thanks and you check your drug coverage. You eat turkey,
Boom,
you go on,
boom.
you eat turkey, you go on Medicare.gov. Just put it in your head. All right. So where do you go and how do you deal with it? Okay. Kristy, I'm going to be really brutally honest, and this is terrible. Okay. I know it's terrible. Do you notice I'm branded?
Yes.
I'm branded. And I will tell you, I will give you all sorts of options. You don't have to use Hey Mo, but we built the Medicare, Mo stands for Medicare Open Enrollment. We built this tool specifically to help seniors tackle the Medicare Open Enrollment conundrum. I never remember when it is. I don't know how to compare plans. What if I pick a plan that's actually worse than what I currently have? I just don't know how to deal with it. It's so frustrating. So we built HeyMo. What HeyMo does is it automatically remembers when open enrollment is. So you can set up a HeyMo account right now in April or June or February or even in October when open enrollment begins. It doesn't matter when during the year you set up an account.
Okay.
You set up an account, HeyMo automatically somewhere around October 30th, because we want all the data to become solidified. That's an insider secret. You don't want to take action right away on October 15th. The data isn't really sound quite yet. Yeah, I know.
Okay.
Kristy, you're like, I didn't know that. Yes. Every year for the last 5 or 6 years, we have noticed that clients that we run on the first day or second day of open enrollment, if we run that same data about a week later, we get different results.
Okay.
Yeah, it's not technically, it's live, but it's not final. I don't, so we wait until typically October 30th. You still have plenty of time to make those changes, but HeyMo automatically will go out and remember when it is and automatically go out and compare your plan options. It knows because you told us what medications you take and what pharmacy you like. It automatically goes out and checks all of your options against your current plan that will be next year. So your plan with all of its changes next year, we're going to show you that. And then we're going to compare it against all of the other plan options you have available to you. In addition to that, we're going to run 20 of the closest local pharmacies in your area. This last year, we found a woman who was saved not by changing drug plans, but by changing pharmacies across the street. There was a little independent Healthy Moi pharmacy across the street from CVS that saved her $800.
Wow.
And she felt really good because she went independent and saved $800. That's a huge win-win. So
Yeah.
changing pharmacies can make a big difference in your total out-of-pocket cost. And come 2025, we are automatically going to compare GoodRx prices against the insurance company coverages. So it's all going to happen automatically. You will get an email or a text message basically saying, hey, Kristy, we just ran your plan options and discovered that for next year, you could save $1,200 by changing from this plan to this plan. Do you want to log in? Do you want to do that? So
Nice.
the whole goal of HeyMo, and because HeyMo does not sell insurance, it is not affiliated with the sale of insurance at all. It's $30 per person per year. $30 per person per year. So,
That's a no-brainer.
well, and that's kind of why we built it initially for our consultation clients, but we're opening it up to more people because this is just, I don't want to get more calls in January and February of each
Yeah.
year. People, I can't afford my life-changing medication anymore. All right.
Heartbreaking.
Right? It is. And in fact,
Yeah.
HeyMo's record savings, this, I need people to hear this. HeyMo's record savings was a gentleman who saved $149,000 changing drug plans for 1 year for 2025. I will tell you, we had between 20 and 30 people. And granted, we were in our startup years, so we only had 300 users for HeyMo this year. We had basically 10% of our people save between $10,000 and $50,000.
Wow.
This is what a big deal it is. Think about
Yes.
it. We have found if you have not reviewed drug coverage in the last 3 years, guaranteed you are hugely likely to be overpaying by at least $800.
Yeah.
It's a big deal. Now, Kristy, I'm sort of doing this crazy, like I went off on a tangent, but I'm going to pull it back
Okay.
because I never answered your question. Your question was, how are people notified of changes? I know you thought
Yes.
I lost that, but I didn't.
No.
So, so people are sent around September. They're sent this really boring, ugly document from their insurance company called the Annual Notice of Changes, ANOC. Annual Notice of Changes. It is an ugly, boring document that's probably about that big. People don't read it. It's one color on grayish paper. It instantly smells boring. People just throw it out. I'm telling you. I'm like,
It's like those thick prospectus that you
right,
get from
exactly.
your investments. Like who's going to read
Right.
that?
Like in social media these days, there's TLDR. I mean, TL, too long, didn't read, is literally designed for ANOCs, for annual notices of changes. It's just, it smells boring, it looks boring, it depresses you, so you throw it out.
Right.
And I will tell you, people just don't look at that document. In fact, I've been told by clients, I never received that at all. Yeah, you did. By law, these insurance companies have to send it. I guarantee you they sent it. I guarantee you, because the penalties for not complying are huge. They sent it to you. I guarantee you threw it out.
Yeah.
Didn't even recognize it because it's depressing. It's like,
Right.
it's a soul sucker.
Right.
So you threw it out. And the worst thing about this is crazy. The worst thing about annual notices of changes, Kristy, one of the biggest details about the changes from year to year are the medications covered or not covered. Are your medications going to be covered next year? Do you know what's not included in the ANOC, in the annual notice of changes?
The
That
ones that were
formulary list.
previously.
That formulary list is not listed in that ANOC. They will have a link. You have to go online to look at the formulary changes. So there is no big comprehensive catalog of what medications are covered or not covered in that annual notice of changes. You have to look in that document for a link, then go online to see the comprehensive list of drugs for next year.
I mean, we wouldn't want to make it easy.
No, why would we do that? You crazy? Those people need to work.
Yeah. They need that knowledge and they have to work for that knowledge.
What, they got
Man.
lives to lead or something? Come on.
I mean, I'd fall asleep reading something like that every time I started.
Yeah, so it's pretty crazy. So people do get notified in September through the annual notice of changes. And that annual notice of changes, by the way, can even tell you that your plan for next year is being discontinued. Like, let's say you're in ABC Insurance Company's XYZ drug plan, and they tell you, sorry, we're discontinuing XYZ drug plan next year. But good news, we're automatically moving you to our KL&M drug plan. Here's the monthly premium, which is now $60 more than the drug plan premium you used to pay. it's just,
And I'm
it's
sure people miss that.
Oh,
I
they
mean,
totally do. They
yeah,
totally do.
yeah.
I've heard, isn't it illegal for drug insurance companies to do that? No, it's actually not. And they did notify you.
Wow.
I know.
Right.
Yeah. So what the other kind of crazy last statistic I want to share with you is really only 29% of Medicare beneficiaries actually review their coverage year over year. Less than 3 out of 10 Medicare enrollees review their coverage. Do you know who knows this? Insurance companies.
Right. Of course
They
do.
know that they are free to make changes to their plans that behoove their bottom lines at the expense of the consumers. It's just true. And they make changes that they're allowed to make, guaranteed. You, as a result, need to make the changes that are in your best interest. You need to watch out for your bottom line, because the insurance companies, that's not their job. Their job is to make as much money as they can.
And if closer to 100% of people were actually doing that, insurance companies may take a step back and say, maybe we need to think about what we're doing, because
Right.
they're probably getting away with it right now.
Oh, absolutely. They'd
Yeah.
be much more competitive in their plan design, and they'd be much more strategic about how they design the plans, but they know very, very few people do, and that they're basically free to make changes to the coverage however they want. And we do see, my co-founder and I have seen some of the games that they play. By law, I should address this myth. This myth is crucial too. People think that insurers have to cover all the medications. No, they don't. They absolutely do not. The law literally states Part D coverage, whether through a Medicare Advantage plan or a standalone plan, must include at least 2 drugs from the most commonly prescribed categories and classes. At least 2 drugs can mean just 2 drugs.
Right.
The most commonly prescribed categories and classes does not mean all categories and classes of medications. We see this. People assume because there's a $35 cap on copays for insulins, people assume that all the insulins are covered by a plan. No, they are not. In fact, there are 9 very common diabetic insulins, and 65 Incorporated and HeyMo did a study between 2024 and 2025 showing that about 50% of Part D drug plans do not cover 5 to 8 of the most common 9 diabetic insulins. If your diabetic insulin is not covered by your plan, you don't pay $35. You pay whatever the retail price is for that medication.
Which is a lot.
The caps only apply when the medications are covered by your plan. By the way, this also includes the $2,000 out-of-pocket spending limit. The spending limit is only capped at $2,000 when all of your medications are covered by your plan. Any medication not covered, you pay the full retail price for, whether that price is $2,000 a refill or $32,000 a refill. It's yours to pay.
That is a tough lesson to learn if you didn't pay attention and you need one of those medications that's not covered that is expensive. So,
Right.
because you're hit twice, you don't get the cap and then you don't get it applied towards your deductible.
Right. Yeah.
That's awful.
Yeah. Yeah. It's really bad. Kristy, I promised you when I promoted Hey so horribly, so
I
gratuitously.
think I wish more people knew about it.
Well,
They
thank
shout
you.
it from the rooftops.
Well, but let me tell you some of the other solutions so that you are an informed consumer. The other ways to review your coverage from year to year, first and foremost, there's Medicare.gov. One of the things I like about Medicare.gov is the fact that you are going to see all the plans available to you in a zip code. All of the Medicare Advantage plans available in your zip code and all the Part D drug plans are shown there on Medicare.gov. I like it. That being said, some of the downsides of Medicare.gov is number one, it's not going to remind you. You have to remember. Put it on your calendar. Remember turkey and then plan review. Turkey, then plan review. I should get that on a
Nobody's going to forget it.
Yeah,
Gobble,
when you're
gobble,
suffering
plan
from
review.
tryptophan and you're falling asleep, you're going to try to do your Medicare drug coverage. This is going to be great. Anyways, I digress. So Medicare.gov is great because it really does show you all the plans, but you have to have the knowledge and to compare those plans and make sure that you're reviewing them wisely. And secondly, you have to remember when it is. There are other options. Another option is a lot of pharmacies will review drug coverage for you. But the downside of that is the pharmacies are only going to tell you about the costs using that pharmacy. So I told you that this Healthy Moi pharmacy, and I swear, I hope this podcast goes viral and Healthy Moi gets all sorts of, I don't even know where it is. I don't know where in the country it is.
I
But
do like the name.
I hope they get all sorts of clients. But they're only going to compare the cost at their pharmacies, and pharmacies can make a big difference in out-of-pocket cost. The third solution is insurance agents. Okay, insurance agents will very often review coverages at no cost to you because they are paid commissions by the insurance companies to sell things. The downsides are, number one, they're only typically going to compare plans that they sell, that they make commissions on. Secondly, if you have a standalone drug plan, like you don't have a Medicare Advantage plan, you have a standalone drug plan. More and more Part D drug plans are no longer paying commissions to insurance agents. So insurance agents more and more are saying, no, we're not doing this. It is nothing but a cost to us. You're on your own. So just be aware that, and if you go to them with a standalone drug plan to review the coverage, very often they're going to look at Medicare Advantage plans and try to change that coverage to a Medicare Advantage plan. So that may or may not be in your best interest. Again, refer to the other podcast on the difference between original Medicare and Medicare Advantage.
Yes, exactly.
Anyway, then there are also SHIPs. SHIPs are state health insurance programs. SHIPs are government funded, essentially government volunteer run organizations. Typically, the people that you work with in SHIPs are volunteers. They are trained 3 to 4 weeks typically. Now, SHIPs, be nice to the volunteer. They are volunteers. They are volunteers. I'm not kidding. Like, be nice to them. They're trying to help you. That being said, there was a really unfortunate study that just came out a little while ago about all the inaccurate information and the inconsistencies coming out of SHIPs. There is no one state's SHIP could be amazing and another state's SHIP is just horrible because there's no standardizations from the federal government of how SHIPs are supposed to be structured.
Got it.
And they're volunteers. You're going to get who you get. You could have an amazing volunteer, but you could have a brand new junkie volunteer who has something going on in their life and is barely present. I don't know.
Right.
Be nice to the volunteers, though, bottom line, because they're volunteering.
Right.
But you get who you get, and it is free, though, too. So that's a benefit as well.
Yeah.
Yeah.
Just caution.
Right. So those, and again, there
Yeah.
are good things. Hey Mo, I think Hey Mo is beautiful and lovely, but we have to charge a fee. We don't make any money from the sale of insurance. So that's our
Right.
downside. You need to know that we work for you, you have to pay us.
Yeah, absolutely.
Right.
Yeah.
But that's a downside for some people. So there are pros and cons to each one of these solutions. And I like to say, pick your poison. Which one
Right.
works best for you? Okay. So those are kind of the solutions on how to deal with it. Kristy, while
Okay.
thinking about it, can I say one more thing really quick?
Yes, absolutely.
If you have a Medigap policy is not an open enrollment thing. You really cannot assume that you can change a Medigap policy during open enrollment. Supplement, Medigap supplement. That is not an open enrollment thing. Medigap policies in many, many, many states will put you through medical underwriting to change Medigap policies. In order to change Medigap policies, technically in most states, you can change a Medigap policy anytime during the year. But whether or not you will get a Medigap policy and be able to change that policy will be based on your health.
Okay.
So open enrollment is not a Medigap thing. You can try to change it during open enrollment, but you could also try to change it in June or July or February.
Okay.
It's not an open enrollment thing.
So is there another period in which beyond the, hey, anytime Medigap, is there another period during which people can change if they miss open enrollment?
For Medigap policies?
Or
Okay.
yeah.
So Part D drug plans, no, unless you're in a skilled nursing facility. If you're in a skilled nursing facility, you can change drug plans once a month.
Oh,
Nobody knows that. Nobody knows that. Same thing with Medicare Advantage plans. You can change those once a month if you're in a skilled nursing facility.
Okay.
Now, Part D drug plans, though, no. October 15th through December 7th, that's it. Medicare Advantage plans, you can choose. You could use October 15th through December 7th, or you can use January 1st through March 31st, which is called the Medicare Advantage enrollment period, open enrollment period. And Medicare Advantage enrollment periods, you can drop Medicare Advantage, you can change a Medicare Advantage policy, you can get enrolled in a Medicare Advantage policy. So you have a bit more leeway, you have a longer runway to make changes on a Medicare Advantage plan. For me, that's not necessarily a reason to pick a Medicare Advantage plan. It's not.
See previous video.
See previous video. I think there's a theme. There's a theme here.
Yeah.
Yeah. And Medigap policies, it is state specific when and how you can change policies in 29 states, actually turning into 27 now. 2 more states added birthday rules. In 27 states, basically once you pick your Medigap policy, that's it for the rest of your life. To change a Medigap policy after the first 6 months, you'll have to go through medical underwriting to do so in 27 states. The other 23 states have what are called some sort of birthday rules or special open enrollment periods, depending on the state. Get to know your state-specific rules, because in these other 23 states, there are periods where you can potentially change your Medigap policy to a different policy with the same amount of benefits or lesser amount of benefits without going through medical underwriting. But don't think for a second that if you don't have a Medigap policy, you can get one. That's not what we're talking about. Or if you have a really chintzy Medigap policy, you can get a more robust Medigap policy. That's not what we're talking about. So,
okay. Well, perfect. Any other advice that you want to give people on open enrollment?
Wow, don't you think I've talked enough?
Just wanted to give you a chance.
I keep saying too long didn't read, too long didn't watch.
Exactly.
So.
I I think people will watch. This is great information and I appreciate it. I hope everyone does watch and I hope that they go check out Hey Mo because I think it's amazing.
Well, thanks. We like it too, but it's you're the consumer, you're in charge of your money, spend it wisely.
And that is a great way to end. Thank you, Melinda.
Thank you, Kristy.